Okay. Make sure I get you. Okay. Hi, my name is Jordan. I'm going to be your nursing student today. Can you tell me your name?
I'm Brady Knudsen.
Okay. Can you tell me your ethnicity and your religion?
What?
Okay, you're white. What is your religion, Brady?
Catholic.
There you go. Okay. Okay, your posture seems straight and you seem balanced when I saw you walk in here. Your effect seems normal. You have a smile on your face. You're good. Your skin, it looks very race appropriate. You don't look pale or jaundiced or anything, so you seem good. You are a younger person and you are very active, so you do not have any, or you would not have any risk for skin breakdown. Okay, I'm going to check for your temperature. I'm just gonna throw it back. Yeah. A little warm. I'll make sure it's even on both sides. Okay, that seems even on both sides. The trigger, can I have one of your hands, please? Flip it. So like that. So that was checking. That was checking for dehydration. So you seem very hydrated. If you were dehydrated, the skin would have stuck up a little bit. Okay. Yeah. So your hair, shiny and clean. Sorry, I'm reading off of the packet. Abnormalities, I don't see any abnormalities in your skin. You don't have any wounds or rashes or cuts or anything. So, well, good. You're a healthy boy. So, neurological. So you stated your name before. Can you tell me where you are?
My house.
You're at your house, okay. Can you tell me about what time it is?
It's like 8 o'clock.
Cool. Good job. Yes. And then can you tell me the date?
April 29th, 2020.
There you go. Good job. Okay, so you are 3 out of 3 oriented, so you're all good. Your speech is healthy. You're not gurgling or anything like that. Do you have any history of seizures or a brain injury or anything? No, you don't. Okay, so your decision skills seem very intact, as you're all with it. So the equality of extremities. So can I have you go like this with your hands, please? So pull towards you, like that, okay? And then push at me. There you go, and then put your arms out. Okay, push up against me. Okay, down. Perfect. Can you put your hands around my fingers? Yes, squeeze my fingers. Okay, good job. Yep, you're good.
Oh, sorry.
Okay, and then push against my hands, okay, and then against them again. Oh, knock me down. And then pick up your feet, push against my hands. Okay, and then up. Perfect. So that was just checking for equal muscle mass on each side, so it was equal. You're all good. Are you feeling dizzy at all? No? Okay, perfect. Okay, so I'm going to check your temperature next. Wait for it to be ready. I have to hold it?
Yeah.
Okay, then it works. I'm going to put it on your tongue. Okay. Just let me know when it's ready. Okay, I heard a beep. So it is 98.9, so good. Okay, and then you don't need to have your glucose tested, so that is not applicable. You are not on a pulse ox, and I also don't have access to that tool, along with the blood pressure cuff, but I would check those two if I had access to those tools. You're not on oxygen. Okay, so I'm going to listen to your, like right under your heart. Is that all right?
Mm-hmm.
Okay, so it's called the apical pulse. So, I'm sorry, I'm gonna go under your shirt. You're okay. Okay. That's good. I have the timer next to that. so it was about 64. That was really good. I'll write that down later. And then next I'm going to check your radial pulse. So that's one of the peripheral pulses. So I'm missing one of your wrists. Okay. I found it. Okay. That one. I can put it down. I also got 64. So that is good. They were the same number. Okay, so head symmetry. It looks pretty symmetrical to me. I'm feeling for any lumps or anything. Do you have any bruise on your head? Is that tender at all? No? Okay, good. Your face looks symmetrical. There is no drooping or anything. That's just for if you had a stroke or something. It usually is not symmetrical. Okay, so I'm gonna check. Yes, sorry, it's a this in your eye. So just look straight at me, and I'm just gonna slide it onto your eye. Okay, look at the other one. Good, and then sorry, the other eye. Good. You have really pretty eye color. Okay. Good job. That looks good. They both contracted on both sides when I used the light. Extraocular movement. Can you just hold my finger? Okay, good job. And there was that, and there was no nice nystagmus, so it wasn't, your eyes weren't shaking when you were following, so that's good. Do you wear glasses?
Yes.
Yes? Like on a daily basis,
No.
or just for reading kind of thing?
Sure. Yeah.
Yes? Okay, cool. Okay, and then when I was looking at your eyes, your sclera looked white and healthy. Do you have any history of cataracts or blurry vision at all?
Blurry vision.
Okay.
Yeah.
It's blurry vision. Is that why you use reading glasses?
Yes.
Okay. Okay. Are you hard of hearing or use any hearing aids? I'm guessing no, because you are young. All right, and so I would look at the tympanic membrane next, but again, I do not have access to the ophthalmoscope to look at his ear. Okay. So I'm gonna check the patency of your nose now. So it's nothing scary. I'm just gonna put my finger on one nostril and sniff. Okay, cool. So simple. Yep, sniff. Okay, they sound good and clear. All right, so I'm gonna look at your mouth now. So keep your mouth for me, please. I'm just gonna shine the light. Okay, clean teeth. Good job. So the mucous membrane was moist and it was pink, and I didn't see any lesions or swelling, so all healthy there. Okay, I'm gonna look at your neck, so I don't see any lumps or the carotid thing. I forgot what that's called, I'm sorry. Okay, so I'm just gonna feel your lymph nodes really quick. I'm just gonna be just going like this, okay? Okay. When I'm checking for these, I don't want to feel any of the lymph nodes because that means that there is something wrong somewhere. There's inflammation or something. Okay, you feel good. So, on to respiratory. Do you smoke at all? Do you have history of smoking?
No.
No, good job. So the respiratory effort. Do you have any, are you short of breath right now or no? Okay, and it looks like you are not labored breathing or anything, and you look good. So when you breathe, I notice that it's nice and even and it's deep and everything. Do you have a cough at all?
No.
No? Okay, good. So I'm going to listen to your lungs now. So I'm going to need, is it okay if I can go under your shirt on the back? Okay. So just scoot forward just a little bit so I can get to you easier. Okay, I'm going to start at the top. And every time I set my stethoscope down, can you just take a normal breath? Okay. And go on the other side. Way under. Okay. side now. Okay, and on this side. Alright. Okay, they sounded good, nice and clear. Oh, let's do the mirror. Okay, nice and clear. I didn't hear any crackles or wheezing or anything, so that's good. Your lungs are really healthy. Okay. So onto your heart. I'm going to listen to your heart really quick. Again, I'm gonna have to get skin on skin. I'm sorry. Or set the cup on your skin. Okay. Good. Alright. That is breathe normally. Sorry, is this cold at all?
No.
Okay. Good. Sorry. Okay. The heart sounds really healthy. I heard the normal S1 and S2 sounds. Nothing sounded irregular. It was all even. Okay. So earlier I tested your radial pulse. It was palpable on your right side. So can I just check your left side really quick? Yes, sorry. Okay. Okay, that was palpable. Okay, this felt good. And then your medial pulse and your posterior pulse, I'm going to check those. So, medial pulse, I can feel it on both feet, and then, okay, feel it on both feet as well. So that is good. Can I see one of your fingers? I just need to check for capillary refill. Okay, it was below 3 seconds, so that's just testing to see how well your blood's flowing. You gotta check for yourself. Okay. You do not have any edema as I looked at your legs, so I'm guessing you don't have to wear any compression stockings or anything. Alright. And then I checked before the extremity temperature and it felt equal and warm on both sides. So the genital urinary system. So you're continent and you don't have a catheter or anything. Do you have any problems with peeing at all?
No.
Urinating? No? Okay, there's no, doesn't hurt or anything? It's
No.
all normal? Good.
Mm-hmm.
Good, all healthy. Okay, so the appearance of your urine, is it just a normal color? Just lighter yellow? Yeah?
Yeah.
Okay. And there's no foul smell?
No.
Okay, good. It's all healthy there. Okay, and then you are not sexually active. I would have to ask that if you were. Alright, so do you have any history of urinary retention? So that means your bladder, you'd be holding urine for a long period of time? No? You're good? Okay, cool. So the GI, so your stomach. Your stomach, when I listened to your heart, it looked normal and round and wasn't flat or distended at all. Okay, so can I have you lay on your back? Okay, so I'm gonna just have to feel your stomach. So just tell me if there's any tenderness at all. No? Okay, I'm going clockwise. Oh, what happens? I need to turn your phone. Okay, so no tenderness at all?
No.
Okay, good. Any recent nausea or vomiting at all lately? No? Okay. Alright, so I'm going to listen to your stomach. So I'm going to have to lift up your shirt really quick. Just a little bit. Okay. So I'm just going to listen for a few seconds in each side. Is it cold? Sorry. Stop laughing. Stop. Oh my god. Sorry, he's laughing for some reason. Okay, I'm gonna continue. One more, you can do it. You're just really ticklish. Okay, we're done. He was ticklish, I'm sorry. So, okay, I heard vowel sounds in every quadrant, so that's good. I mean, you just ate dinner, so that's probably why I can really hear it well. Okay, you can sit back up if you would like. So I have a few more questions for you. So when was your last bowel movement? So last time.
Earlier today.
Earlier today? All right. Was it a normal size and color for what you usually?
Sure.
Okay, cool. All right. But you're not constipated or having diarrhea, anything at all? It's all normal. Good. You do not have a stoma, so that is good. That is when someone has a surgical something on their stomach. Okay. You don't have any NG tubes or anything. So for your weight, is it a normal weight range? It hasn't fluctuated drastically lately? No? Okay, good. Okay, and then you're on a normal diet, I'm guessing. Good. Okay, so musculoskeletal system. So I'm gonna have you stand up, please. Sorry, just can you just walk to the cabinet and back? Just normally. Okay, and walk back. All right, your gait seems normal. You're very steady. I do not have to help you. So his activity is up and walking, so it's ad lib. So as I tested his extremities earlier for your muscle strength, so they were both even. Your arms and your legs, they're even on both sides and very strong. Almost knocked me over. Okay, and then the range of motion. Can you lift your arms up and put them back? Like do arm circles. Okay, and then just lift up your legs, both of them, and then kick your knees out. Just your knees. Your knee.
Oh.
There you go. And then circle your ankles and your wrists. Yeah, sorry. Okay, so your range of motion is really good. All flexible and everything. And you do not have any amputations and your spine. And I'm going to have you stand up really quick and face the wall. And I'm going to have you bend over. Don't hit your head. I'm just going to feel your spine to make sure it's straight. Okay, all good. No showings of scoliosis or anything? All right, so I have one more question. So for pain, at any time in the last 5 days, have you been on any scheduled pain medicine? No? Okay, have you had any other medications that, like Advil as needed?
No.
No? Okay. And then, have you seen any non-medication interventions for pain? So, like ice or going to the chiropractor? Okay, no? Okay, have you had pain or hurting at any time in the last 5 days?
Sure.
Where?
My back.
Your back, okay.
My back is messed up.
Your back is messed up, okay. Yep, you messed it up during basketball, I think, right? The baseball, sorry. Okay, so how much of the time have you experienced pain or hurting over the past 5 days?
Most of the day.
Most of the day? Okay, so that's very frequently. What causes or increases your pain?
Jumping and like running and stuff.
Jumping and running, okay.
If I like stay in one position for a while.
Okay, so just like,
lay down like for a long time.
okay. So it's like it all gets tightened up and everything when you're just in one position, okay. So you said your location is on your back and you, like your
lower back.
Lower back, okay. The pain effect on your function over the past 5 days, has the pain made it harder for you to sleep at night?
No.
No? Has it limited your day-to-day activities because of the pain?
A little bit.
A little bit, just like
I can't do it as much.
Yeah.
As long.
Okay, so like when you have baseball practice and stuff, you.
Yes.
Yeah. Okay.
You sit out.
Okay.
Sometimes.
Oh, fun. Okay. The pain intensity. So. Okay, so can you rate your pain on a scale of 1 to 10? 1 being not any pain at all, and 10 being the worst you've ever felt.
Like a 3.
A 3, okay, so just a little bit there. Okay, so the quality of your pain, is it like a prick or an achy or burn, throbbing, really sharp pain? Okay. All right. In your opinion, how important is it for your pain treatment to completely eliminate your pain? So if you're taking like Advil, or if you're icing your back, how important is it for that to help your pain?
Oh, a lot.
Really important?
Yes.
Okay, I would agree. So what is your acceptable pain or level of pain? So like what can you live with? Can you live with like, you would rather have absolutely no pain, or can you live with a little bit? A 1, so mild, okay. So objective assessment for pain, indicators of pain that's possible in the past few days. So you don't usually have like, you're not showing facial expressions that you're just grimacing like you're in pain. It's more verbal, just like, oh, my back hurts.
Sometimes.
It's more, okay, more verbal.
Like sometimes, like I get that facial expressions.
When?
It really hurts.
It really hurts?
Like if I have to like do a run, it hurts.
So like during practice or physical activity, that's when you show more nonverbal stuff?
Because I'm like bouncing.
Okay. Makes sense. Alright, so that completes your assessment today, Brady. Thank you for helping me with this. Hope you have a great day.